Hi everybody. Today we're going to talk about what Hypermobile Ehlers-Danlos Syndrome is. Now, Hypermobile Ehlers-Danlos Syndrome is the most common in a group of syndromes, Ehlers-Danlos Syndrome, and the list of specific syndromes there is growing almost by the month as scientists are paying more attention to it. Hypermobile Ehlers-Danlos Syndrome affects approximately between 1 in 3 and 1 in 5,000 people in the general population, and it's most commonly found with people that have joint instability, joint hypermobility, chronic pain, and some of the common issues associated with Ehlers-Danlos syndromes. So to begin with, some of the common issues you'll find across a lot of the Ehlers-Danlos syndromes are things like skin hyperextension, ease of bruising, ease of tissue damage. So for example, people that can be cut very easily, their skin will be incredibly stretchy. You also find what they call Neuro-Psychiatric issues as well, in terms of people suffering depression that is chemically caused by the Ehlers-Danlos, as well as fatigue, mental fatigue, brain fog, and things of that nature. Now, I myself have been diagnosed going back to August 2021 with Hypermobile Ehlers-Danlos Syndrome, and it took me about 16 and a half to 17 years to get a diagnosis. That is still on the long side for hEDS, but it is common for it to take a long time. Now, the most common signs, as we've already said, are joint instability, joint hypermobility, chronic pain, and obviously the other group that we've already discussed of the common EDS issues. Now, if we start with the first, and we start with joint instability, most people's joints are very uniform in how they operate. So, for example, our knees are hinge joints. They go backwards and forwards. They move in one axis, in one direction. Knee instability means that there is a potential for them to go sideways, for example, in a way that they're not supposed to. Our elbows are also, as you can see here, hinge joints, and that can mean that our elbows are prone to slipping one way or the other. It means that applying that to every day, for example, if somebody with hEDS is impacted on a joint, then a person without hEDS might get away with that with a bruise or a bit of pain or discomfort because of the instability in the tissue, in our soft tissue in our knees. That might cause the stretching of a ligament or a tendon or a tear or a dislocation. Now, fundamentally with hEDS, it's the collagen, and human beings do have a lot of collagen in them, that make up our skin and our connective tissues like ligaments and tendons. It's the collagen that's affected. Now, they're not 100% sure of the cause of this, but it's most likely, considering the basis of other Ehlers-Danlos syndromes, that this is genetic as well. Now, if we move on to hypermobility, for example, there's a test for this. It's called the Baton scale, and it's a test whereby they put you through the physical elements and they test how flexible you are. So many of us know somebody who would have been called double jointed or very flexible when we were growing up. Those individuals might have what we would call benign hypermobility, which just means exactly that. They're flexible, they're hypermobile, but there's nothing really to be worried about with it. However, for those of us with hEDS, the extra flexibility is caused by the laxity in our ligaments and tendons, and it therefore makes us very vulnerable to the next part, which is dislocations. So if we use myself as an example, I can bend my fingers back an incredibly long way, a lot further than they should go. My knees bend backwards. I can put my legs together completely straight, bend over and put both palms on the floor, and as you can plainly see from the video, I'm not exactly very into exercise or not doing stretches at the gym every single day, so it's not like I've physically prepared myself for that task. It's just something that I can do naturally. And I can also a little bit bend my elbows backwards. That's another common one for people with hEDS. Now, dislocations, there's two categories. We have subluxations and dislocations. Subluxations are where part of the joint moves in a way that it shouldn't. It doesn't come fully out of the joint alignment or fully out of the joint space, but it is uncomfortable. We then move over to dislocations, and some of us have had dislocations ourselves or seen other people have dislocations. Many who are watching this and know me personally have seen me dislocate in various ways at various times, and a dislocation is effectively a subluxation that goes too far. So again, if we take knees as an example, because the kneecap is very easy to see, the kneecap will move to the outside laterally, so it will move, if it's the right knee, round to the right, and if it's the left knee, round to the left, out of position. Now, often, if you don't have an underlying condition and it's your first ever dislocation, it is quite possible the kneecap will go back by itself because the ligaments and tendons will be stretched too far, and then they'll pull it back themselves. However, if you have a condition like mine and you've had a lot of dislocations, at that point the ligaments and tendons are so stretched out, think of it like cutting the elastic at the top of a pair of socks, for example. Although the top of the pair of socks will clamp around your leg loosely, if the elastic fails, they won't clamp round, will they? So in that case, you've then got to manually reduce, and reduce is the technical term for correcting a dislocation and making it not dislocated, but you've got to fix the issue yourself. Now, for people with hEDS, as we call, what's the acronym for Hypermobile Ehlers-Danlos Syndrome, it's quite common that, for example, if you have a knee dislocation, and that can happen, as it did in my case, as a child due to physical trauma on the body, that then putting pressure, sustained pressure on the other leg will cause that to degenerate. Obviously, hEDS is in itself a spectrum, as EDS is, so there's a lot of people out there who have hypermobile Ehlers-Danlos syndrome, and it's not that serious in their particular case. They might have some chronic pain, which is obviously a lot to deal with. They might have dislocations a dislocation every few months or every year or something like that, and they are at a less severe stage of the condition. And then you get to people at my end of the spectrum, and there aren't too many of us that have dozens and dozens and dozens and dozens and dozens and scores of dislocations every single day. And there's a lot of joints in the body that people don't even think of. So if we take myself, for example, I dislocate my fingers, my toes, my kneecaps, my elbows, my shoulders. I could dislocate my hips. The jaw is one that a lot of people don't think of, and from all accounts the jaw is supposed to be the most painful, because if you've ever had work at the dentist, the serious nerves that run through the frontal area of the face are incredibly sensitive compared to the nerves that are in the knees or in the elbows, and that will result in a lot of pain. And unfortunately, because the jaw is hinged by some very small bones at the sides up here, it means it's very easy for them to fracture during the dislocation process, and it to cause serious issues even with just one dislocation. So that is an overview of hypermobile Ehlers-Danlos syndrome from a causes and symptoms situation. Now, at the moment, diagnostically, it really is a case of looking at, in the UK, it's a case of looking at somebody's family history, it's a case of looking at their medical records, it's a case of doing a physical exam on them, like the Baton scale, and working it out from there. So in my case, we worked out that it came down via my father's side. They looked at my medical history, the fact that I'd had dislocations of multiple different joints, and the majority of those dislocations had not been caused traumatically, where I'd taken impacts or had to twist violently or things like that. And then obviously I did the physical test, and in the space of 45 to 50 minutes of that appointment, the consultant geneticist was happy to immediately say, yes, Robert, you've got Ehlers-Danlos syndrome, particularly hypermobile Ehlers-Danlos syndrome. Now, in terms of management and things like that, this is where it starts to get more difficult. hEDS is certainly in the category of conditions in modern healthcare that is not treatable, it's not curable. it is potentially manageable, and a lot of that comes down to, if you're in the early stages, physiotherapy and adequate pain relief. However, once you start getting into the more severe stages of the condition, as I'm in, at that point physiotherapy is not going to cause any benefit whatsoever. In fact, you could argue that trying to put pressure on your joints more regularly is going to lead to more dislocations. So your only real option is adequate pain relief and things like pacing, for example, in terms of trying to work out the best way of going about your day without trying to put too much pressure on your body. And that's a big part of where this campaign is going at the moment in Scotland. Because of the drug death situation, there are major restrictions on medication, particularly painkilling medication. And while I fully understand those and support those in the majority of cases, in my case, when doctors are telling me in their professional capacity that they professionally believe that I need more medication due to the sheer number of dislocations I'm having every day, then that's what I'm trying to change with this. But first and foremost, that's an overview of Hypermobile Ehlers-Danlos Syndrome. You can go and look at websites like the Ehlers-Danlos Society. They have a huge amount of information out there. They also have a directory of a few medical experts in various parts of the world, not just the UK, but also Australia and the US, who have an interest in hypermobility and Ehlers-Danlos syndrome. There are also some private clinics around. I wouldn't necessarily recommend them simply because I haven't experienced their care, and I think it's wrong of me to recommend something that I have no personal experience of. And that's something I will make abundantly clear to everybody. I would only ever recommend something if I had personally used it or had personally experienced it. So it's worth keeping an eye out on those people you know that are incredibly mobile and hypermobile and are prone to dislocations, because it is often 7 to 8 to 9 years for people to get a diagnosis if they are indeed a sufferer of hypermobile Ehlers-Danlos. But that will give you an overview of the condition, particularly the condition as I experience it, and what to look out for when suggesting or suspecting that somebody themselves may have it undiagnosed. Thanks very much for your time, and I hope to see you soon to look into my story, so to speak, where we'll look at my past, present, and unfortunately my future as well, both with and without the condition. Thanks very much for your time, and have a great day.